In this video, we'll discuss Clara cells and surfactants, their function and the function of the surfactants. Clara cells are pneumocyte type 2 in between the pneumocyte type 1 cells in the alveoli. Pneumocyte type 1 cells are concerned with gas exchange. Clara cells are simple, non-ciliated, low columnar or cuboidal cells, whereas the terminal bronchiolar cells are ciliated columnar cells and have smooth muscles without goblet cells and cartilage. So what's the function of the Clara cells? Clara cells secrete surfactant, and surfactant decrease the surface tension. What's the composition of surfactant? More than 80% of surfactants are phospholipids, and phosphatidylcholine or lecithin is the major component of surfactants. 60% is dipalmitoyl phosphatidylcholine and 20% is phosphatidylglycerol, ethanolamine and inositol. Which enzymes do they contain? They contain proteolyase and oxidase. What's the function of surfactants? Number one, surfactant decrease the surface tension, so prevent lung collapse, facilitate lung expansion, increase lung compliance and decrease the work of breathing. Number two, they protect bronchial epithelium by degrading toxins which come in the inhaled airs, and they opsonize bacteria. Number three, they decrease surface hydrostatic pressure in the alveoli and prevent the movement of fluids in the alveoli, clear mucus, keep the lung dry, and prevent pulmonary edema. And number four, the Clara cell function as a stem cell. So they divide to regenerate the bronchiolar epithelium. What's collapsing pressure? Collapsing pressure, P, is the ratio of twice the surface tension with the radius. If the radius is big, as in larger alveoli, collapsing pressure is low. If the radius is small, as in a smaller alveoli, the collapsing pressure is high. Low surface tension in a small alveoli during the expiration prevent the collapse so they can reopen. Absence of surfactant increases the surface tension, and if the surface tension is high, it's difficult for the smaller airway or a small alveoli to inflate or reopen after they deflate in expiration, causing alveolar collapse or atelectasis. During inspiration, surfactant molecules move apart, and during expiration, the surfactant molecules move together, so reducing the surface tension. Why decrease in surfactant in neonate causes respiratory distress syndrome? The respiratory distress syndrome or high line membrane disease. Respiratory distress syndrome is more common in premature babies. Surfactants are synthesized between 24 to 28 weeks of gestation and is usually present in enough quantity by 35th week of gestation. What's the predictor of fetal lung maturity? LS ratio, lecithin sphingomyelin ratio, is a predictor of fetal lung maturity. An LS ratio of more than 2:1 in amniotic fluid indicates adequate surfactants. What are the other disorders in neonates in which surfactant decreases? Obstetric and gynecological problems, C-section and multiple births, and the hormone hypothyroidism, glucocorticoids, and maternal diabetes because of insulin can also cause a respiratory distress syndrome. And inhalation of 100% of oxygen for a long period can also cause respiratory distress syndrome. How thyroid hormone is involved in causing respiratory distress syndrome? Thyroid hormone increases the size and number of inclusion in the type 2 cells or Clara cell. So respiratory distress syndrome is more common and severe in infants with low plasma levels of thyroid hormone. Glucocorticoids also cause maturation of surfactants. So absence of glucocorticoid causes respiratory distress syndrome. And respiratory distress syndrome is also more common in infants born to diabetic mother. So what are the adult disorders in which decreased surfactant causes respiratory distress syndrome? I put it alphabetic mnemonics: A for asthma and atelectasis, B bronchitis and bronchial occlusion or obstruction, C cystic fibrosis and cardiac surgery, D for distress syndrome, respiratory distress syndrome, and E for emphysema, and then 3P pneumonia, pneumothorax and pulmonary artery occlusion, and O for inhalation of 100% oxygen for longer periods.